Okay, thank you very much. Next, let's go to next conference on cessation and using mobile phones. That will be presented by Dongbo and Susana Robinson, and introduced and moderated by Josep Maria Suelves. Dr. Suelves is a psychologist working at the Public Health Agency of Catalonia. He more specifically is in charge of the tobacco control unit here in Catalonia, putting all the services working to tobacco control, prevention, interventions in schools, and so on. So thank you very much, Josep Maria, for accepting moderating this, and thank you very much to Susana and Dongbo. Your turn. We are on time, so our objective is to go at 1:30 for lunch in the same place where we have had the coffee break. Okay? Thank you very much.
Okay, thank you, Esteban, and thank you for the presentation and for inviting me to be on both sides of the table. It's been an interesting morning, and I hope that it will continue like that. As it was mentioned at the beginning of this symposium, tobacco use is still very prevalent in Europe. That means that from a public health perspective, it's useful to find tools efficient enough to reach a significant proportion of this large population of smokers. So the idea of including information and communication technologies on tobacco prevention and control activities is always a good idea, which is supported by a lot of evidence that show us that we can put the same tools we use in face-to-face interventions on the internet, on the phone line, to have efficient and useful quit lines, cessation applications, and many other opportunities to show how technology helps us to advance in tobacco prevention and control. Today we have here Susana Robinson and Dongbo. They are working for the WHO in the development of an initiative just for the use of the mobile phones in the area of chronic diseases and in general and tobacco in particular. So I'm not going to steal you more time. Just please start your presentation. Thank you.
I'm sorry, I need you to help me change the slide. Good morning, everyone. First of all, I would say it's my great honor to be here with you, talk about talk about how to help tobacco users to quit as a part of a comprehensive tobacco control approach. And my name is Dongbo, working in WHO. Just want to share with you what I'm doing at WHO. It's mainly to coordinate tobacco cessation work across the 3 levels of the organization, mainly to support the WHO member states on strengthening their national tobacco cessation treatment system related to Article 14 of the WHFCDC. So according to Article 14 guideline, I think you already know, all the parties should aim to develop comprehensive tobacco control strategy to provide a variety of interventions. But today, we're going to focus on one strategy or one approach, that how to use mobile technology to deliver cessation services. So my colleague Susana and me is going to focus on one approach to support tobacco users to quit. That's something I would like to share with you. Then for my part, I will try to use 15 minutes to discuss what is mCessation and what role the mCessation can play in terms of strengthening the national tobacco cessation and treatment system. So that's what I'd like to discuss with you. First, what is mobile cessation, or we call mCessation? Actually, at this moment, there's not a widely agreed definition. But in a broad sense, mCessation can be defined as tobacco cessation interventions delivered by mobile phones that have many, many things, mainly through mobile text messaging, and mainly provided to tobacco users who want to quit. So that's the, in a broad sense, mCessation can be defined as this. So text messaging as a new way of delivery of cessation intervention was first tested in New Zealand in 2005. Following the New Zealand study in 2005, and mCessation was started to be provided as adjuncts to many existing cessation services like telephone quit line, like the internet-based services. So here I just listed 3 examples. For example, the New Zealand quit line have provided a text-to-quit program, and the UK National Health Service Stop Smoking Service also provides some program called the Together program. And the US National Cancer Institute, they provide smoke-free text program as well. And at this moment, all over the world, more than 50% of quit line actually are providing text messaging as part of their comprehensive cessation program as well. So since 2013, WHO and the International Telecommunication Union has started to support countries to implement standalone nationwide smoking mCessation program through a joint initiative called Be Healthy, Be Mobile. Susanna is going to present more detail about this initiative. And until now, we have 4 countries are implementing nationwide mCessation program. That's Costa Rica, Tunisia, India, and the Philippines. Also, you can learn more details about their experience in these countries through Susanna's presentation later on. Now let's look at the evidence on mCessation. Is mCessation effective? Is mCessation cost-effective or not? So according to the latest Cochrane review, this is a Cochrane review published in April this year, combined 12 studies indicates that mCessation or mobile phone-based intervention can help increase the 6-month quit rate by around 70% compared to the control groups. So it's very effective, or similar to the traditional cessation interventions. And the evidence also shows if we combine the mobile phone-based intervention together with like internet-based intervention, we can get a higher effectiveness and last longer. So the evidence shows the combined intervention can double the chance of quitting successfully, lasting for up to 12 months. So that's another message. We need to combine them with other interventions if possible. Evidence also tells us the smartphone applications at this moment sounds like there's no published study demonstrate the smartphone applications able to effectively help smokers to quit. That's why the Be Healthy, Be Mobile initiative mainly focus on service delivered by text messaging. Let's look at the cost effectiveness. There was one study analyzed the text-to-stop program in UK. It shows interventions delivered by mobile phone, mainly text messaging, was cost-effective and even more cost-effective than quit lines in UK. I just mentioned in UK. In some other countries, the cost effectiveness of telephone quit line can be lower, obviously no, can be higher. So in UK, the study shows the cost per quitter for mCessation intervention was around $278 British pounds, which is around just 1/3 of the cost per quita for telephone counselings. So this is the basic information like what's the cost effectiveness about mCessation. So we can see mCessation is effective and it's cost effective. Now let's discuss, should we include mCessation into the comprehensive National Tobacco Cessation Program or not? The Article 14 guideline give us an answer regarding what kind of support should we offer our tobacco users to quit. So you can see that the recommendation is each party should aim to develop a comprehensive tobacco cessation and treatment system to provide a variety of interventions, including mainly 4 approaches. The first we call population-wide approach, or we call wide reach approaches, which include mass education and communication programs, campaigns, and also brief tobacco intervention integrated into healthcare systems, and also national toll-free quit lines. This is the first type of approaches. The second is more intensive individual approaches, which are able to have a higher quit rate, like specialized tobacco cessation treatment. And the third is the tobacco cessation medications. And the fourth one we call novel approaches and media. You can see here, cell phone text messaging is under this approach. So according to this recommendation, you can see mCessation has already been recommended by Article 14 guideline as a key component of comprehensive national tobacco cessation program. So that's the answer. Yes, we should include mCessation as a part of a national tobacco cessation treatment program. And now the last part I would like to discuss with you. Yes, we need to include, and then we have to think about how mCessation can help us strengthen the comprehensive tobacco cessation treatment system in the country. If we evaluate the overall population level impact of tobacco cessation program using the REM framework, we will see at this moment the potential of public health impact of tobacco cessation has not been realized. You see, the population level impact of tobacco cessation program is very, very limited. One reason is one of the determinants, the reach, is very low or is very limited. In other words, the proportion of the target population who participate in tobacco cessation or who receive the tobacco cessation interventions is very, very low. According to 2015 WHO report on the global tobacco epidemic, you can see at this moment only around 24 countries are providing comprehensive tobacco cessation services, including 8 countries from the European region, and only cover around 50% of the world population. So the reach is around 50% of the world population. And mobile technology actually able to help us overcome this challenge. The reason we all know, because the mobile phone has the potential to reach a large number of tobacco users, and also has the potential to significantly increase the reach of tobacco cessation services in the world. So here I just show you the data, maybe a little bit out of date. According to the ITU data, by end of 2014, there were about 7 billion mobile cellular subscriptions, and corresponding to the mobile penetration rate of 96%. Even in developing country, they have the mobile penetration rate about 90%. So you can see this represents a unique opportunity for us able to deliver services to a large number of tobacco users. So that's the reason why we need to talk about or think about how to use mobile technology to help us improve the reach of tobacco cessation interventions. And if we use mobile technology to deliver services, we will get some other advantage which we cannot have from the traditional cessation services. For example, it's very easy to use. we can deliver services to the people anywhere and anytime. Even you switched off your mobile phone, you can still receive text messaging, right? This is something other things cannot do. And another thing is the mobile technology able to reach some vulnerable populations who traditionally have no access to the cessation services, like adolescents, like young tobacco users. And evidence shows the mobile phone-based services are more appealing to young smokers. So that's the reason why we need, another reason why we need to promote service delivery through the mobile technology. So in summary, I've just said mCessation is effective, is cost-effective, should be included into the national comprehensive tobacco cessation treatment system, and also it has huge potential to significantly increase the reach of our tobacco cessation programs. So that's the key message I would like to share with you. Now I would like to leave my colleague to share with you the country examples. Thank you very much.